Hey everyone, hope everyone's doing well today. Sorry for the late start. We just had a few technical difficulties, but I'm thankful you've taken the time to stick around and tune in today for today's talk. Again, my name is Sanjiv Lakhia. I'm a surgery and spine associate. I'm a physiatrist. And today I want to talk to you all about an exciting option for those of you who are looking for less aggressive approaches to your pain and injury. And the title of today's talk is going to be Orthobiologics, and we're going to focus on platelet-rich plasma treatments today. I know your time is valuable, and we'll go ahead and get to it. So again, my background, I'm a physiatrist. I've been in practice now for almost 18 years, and I offer more of a hybrid integrative approach. We do a lot of traditional injections, back pain, neck pain, joint pains, but we also do, I do a fair number of integrative approaches. And really, as we are specialists in non-surgical orthopedic and spine care. And PRP is something that we've been offering at Carolina Neurosurgery and Spine for quite some time that a lot of people aren't aware of. So let's get into it. Let's discuss PRP. It's been around now, really mainstream for about 20 years, and it gets a lot of publicity through professional athletes who use it to help recover from pain and injury and return to play sooner. Everyone from Tiger Woods to Kobe Bryant has been exposed to platelet-rich plasma injections. And when we look at the definition of PRP, it's really a sample that has excess of 600,000 platelet C. So it's really about you take the blood and the blood sample, and then you concentrate it into a rich platelet solution. So some of the terms you hear, platelet-rich plasma, again, that's where we take your blood sample, we concentrate it into a highly potent platelet solution. But then there's also kind of some leftover solution, which is platelet-poor plasma. You may hear terms in the regenerative, maybe it's just marrow aspirate and MSC, or mesenchymal stem cells, or medicinal signaling cells. So today we're really going to get into the component. Many of you have heard of PRP in different applications. Perhaps the most popular one is in the field of cosmetics. For all of you out there who are looking to age youthfully, PRP injections for wrinkles and facial features is very popular. But it's used in a lot of different applications: orthopedic surgery, oral surgery. So, for example, if you get a bone graft, the surgeon may pack that with some PRP. We've seen PRP used with general surgery procedures, where you need to assess. And also in our, PRP has applications as well. For our purpose today, we're really talking about PRP for orthopedic applications like hips, knee pain, shoulder pain, arthritis in these regions, low back pain. So what are the benefits of PRP? Well, there's multiple. For one, our primary goal is to accelerate wound healing. PRP is perfect to be used in an area where the blood supply is sparse. So we're talking about tendons and ligaments. These are areas where it's not robust with vascular supply, and PRP gives the body a nudge. It enhances wound strength, so it really makes the healing stronger. You can improve regeneration, although it's more of a healing response. It's not like the who just regrows, but it helps them heal it properly. PRP is a natural antibiotic, so we really have reduction in infection risk. It enhances blood supply, angiogenesis as we call it, and it does help lay down the matrix for collagen production, which is important for healing. So platelet-rich plasma, the value proposition, what are we really getting with PRP? When you go to a physician or practitioner and you are paying out of pocket for this type of procedure, which is not typically covered by insurance, what are we trying to get with PRP? Again, PRP's main goal is to improve the blood supply to the area, the circulation, and deliver growth factors. Growth factors are healing proteins that you already make in your body that we concentrate through draw, and we inject it into targeted tissue. But in that sample, we get platelets, we have white blood cells, we have lymphocytes and granulocytes. And all of these immune chemicals stimulate the body to release growth factors, which help repair tissue, improve circulation, and speed up healing. The mechanism of action of tissue regeneration or tissue healing is you have to have, number one, you have to have these signaling proteins that help the body send adhesion molecules. You want to have these cells come to the area to help lay down this scaffold, these platelets, which serve as kind of like the substance for healing. And then the platelets, they're like the general contractor. They send signals throughout the body to flood the damaged tissue with mesenchymal stem cells, with other healing proteins like platelets and lymphocytes and granulocytes and adhesion molecules. These are all fancy medical terms which describe natural healing proteins in your blood that when we target it in injured areas, accelerate recovery. It's really fascinating. This is just a slide sample of a normal platelet count versus a PRP platelet count. You certainly can see just on a normal blood draw on the left of your screen, you see sparse platelets, and then it's all purple on the right. That's really what we're looking at. We're trying to get millions and millions of platelets into the blood sample. So when you look at what makes for successful PRP, it's very important. Like years ago, we really didn't know. But now we have a lot more information, and the devil's in the details. You want to know when you see a provider, what's the concentration of the platelets? How effective is your system in concentrating those platelets? What are the key? And when you look at optimal concentration of platelet-rich plasma, we want to see all sorts of growth factors like PDGF, TGF-beta. These are all proteins that stimulate blood supply and they help repair damaged tissue. So these are very, very key. What we do is we take the blood sample out, and I'll talk about that. I'll post a link to a brief video that we did with one of my nurses who did the blood draw, and just talks you through almost like a processing of PRP. That a little more detail, but optimal concentration of concentrated platelet product. We have white blood cells. We can really get very specific. We can do leukocyte rich, which means the platelets also have a certain percentage of immune cells with it for a specific purpose, or we can do a leukocyte poor. If we're doing for the joint, maybe we don't want to be as stimulatory, so we don't have as much post-procedure. So the bottom line is the research has shown you need 1.5 to 3 million platelets per cc for this whole thing to be effective. If you're not getting that, you might as well just be injecting platelet-poor plasma. You're not going to get the therapy benefit. And we've done a really good job partnering with organizations to deliver proper platelet-rich plasma. We use state-of-the-art centrifugation. We have update kits that we use. We're really modern edge and cutting edge, and everything's evolved over the last 5 to 10 years. Why is it so important? Well, as you would expect, as we age, our ability to heal, our heal declines. And this graph just really demonstrates the presence of mesenchymal stem cells, which are throughout our body and particularly in our bone marrow. And when we're younger, that bar graph is way up here. And as we're older, those healing proteins go way down. So doing it with platelet-rich plasma can be really, really effective. So what can you expect? If you decide you want to come on in, first I'll do a consultation and we'll just take a look. You have to do a very specific physical exam and decide what's the proper diagnosis. I've seen a lot of people who have come in for PRP and they maybe didn't have the right diagnosis and needed some other form of treatment. So that's first and foremost. You need to see a provider who's skilled in history and physical examination and has experience. After that, if we decide, for example, let's say it's going to be your knee. Let's say you have some arthritis in your knee, and we don't want to do steroids anymore because we know the steroids over time can degrade the joint and make things worse. We decide to do PRP injection for your knee arthritis. First, I'm going to counsel you on kind of the prehab, the pre-injection period. We're taking these healing proteins from your body. So the healthier you are, the more powerful the effect will be. So I always want my patients to go through an anti-inflammatory nutritional protocol. I give you literature. We're talking about eating a healthy food plan low in processed foods, low in sugar, eliminate alcohol, eat healthy fats, plenty of fresh fruits and vegetables, and lean proteins. Then after that, I want you to optimize your sleep because that's when your body really starts to repair itself and get prepared for the procedure. And I want to eliminate other toxins, right? Certainly you don't want to be smoking, we want chemicals we're putting into our body, eat organic foods. And then we're going to ask you for a period to hold the medicines that can affect platelet function, such as aspirin and NSAIDs. Prior to the procedure, a few days, we want you to hydrate, 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 because my resident vampires, we need to get a lot of blood. We're going to get about 60 cc's, 120 cc's, sometimes even more. We want that experience for the blood draw to be easy and accessible for you and painless, and most of the time it is. You come on in, we take your blood sample, and then we take the vial of blood and we transfer it to collection devices and we put it into a centrifuge that spins it and rotates it for a period of time. And we isolate. We have a layer of plasma, we have a layer of red blood cells, and in between you end up with what's called the buffy coat, which is the concentrated platelets and proteins. And eventually you get that liquid gold. After we process it and separate it, we have about anywhere from 5 to 10 of platelet-rich plasma. And then I have you come on into the injection suite. And all my procedures, image guide, almost 20,000 procedures over the course of my career, of various joints throughout the body. And you have to get the injectate, the PRP endoscopy, and ultrasound guidance, which is so critical. The procedure itself can generate a mild inflammatory reaction, which means you might have some soreness anywhere from a few days up to a week. So the first week after, I always recommend a little bit of rest. You can use a little bit of ice. We avoid NSAIDs, anti-inflammatories, because we don't want to block the healing response. We avoid steroids as well. And then afterwards, we talk to you about pain management. Certainly we take good care of you. If you need some Tylenol, if you need some meds for the first week, we definitely have got your back. And then about the 2-week mark, depending on your condition, we may put you in some gentle rehabilitative physical therapy to get you moving again and feeling better. One big question always comes up: when does the improvement start? I will mention that this is different than steroids. We're looking at about 1 to 3 months for the. So let's wrap up here a little bit with a few studies. There's a lot of research, a ton of data now in the medical literature on PRP. This is an article where they talk about injecting an injured Achilles tendon. Of course, this was in rats, but they showed pre and post pictures of healing of the tendon injury. Really fascinating. And then this is one of the landmark studies by Mishra where they did PRP here for tennis elbow. Anyone play tennis? Anyone play sports where you're gripping and get a lateral elbow pain? The lateral epicondyle where the tendon attaches has poor blood supply. And in this study, they injected with PRP, and almost 90% of people had relief at the 2-year mark. There's no steroid shot that will do that I'm aware of. And this is really, really a fascinating to put PRP on the map. And PRP at CNSA, again, we're going to drop that link in for you guys to take a look at and watch of us processing the PRP and just giving a little bit more information on it. All right, so I hope that was helpful, quick but full of information to help decide if you're a candidate for PRP. If you're having orthopedic issues, knees, hips, shoulders, elbows, back, you're trying to avoid surgery, and you want to avoid steroids, really consider PRP as an option. It's something that I've done for myself with good success, and we've been utilizing it for several years, and we're here to help. And I encourage you to make an appointment, a consultation, and figure out what the best path forward for you is. Any questions? Go ahead and drop your questions in the chat, and even if you're watching this in a replay, and we'll definitely try and get back to you with answers. I'm also going to link in the chat for you guys, giving you a free access to my course called Tame the Flame. It's a digital course where I go through nutrition and sleep and stress and how to optimize those things. It's kind of my gift to y'all for Thanksgiving. You can download it and use it. Shoulders too, absolutely. Shoulders, particularly rotator cuff injuries. The research on rotator cuff repairs when it's just partial thickness injuries, people can do very, very well with PRP and physical therapy and to try and avoid surgery. Info on bone marrow. That's a great question. Bone marrow is a whole nother topic. The way I would kind of say it is this: when you look at the world of regenerative cell treatments, you have prolotherapy, which is the utilization of glucose-based solutions to stimulate healing. You have PRP, and then you have stem cell. Prolotherapy is like the Honda Civic, PRP is like your Lexus, and stem cells like your Lamborghini. PRP attracts stem cells to the area. It sends signals. Stem cells, you're literally harvesting that from the hip, and we're delivering like fertilizer in the soil. So we're happy to do a talk on that as well if there's interest. All right. Well, thank you guys for tuning in, and feel free to reach out if you have any questions. Have a great Thanksgiving.